Hello, my name is Alan Acton from Cary Family Dental here in North Carolina, and I wanted to show you a really cool case that we did recently. Placed an implant using guided surgery and a 3D printed stent. I think it's very cool. So the patient is Michael. Michael had a tooth on the upper right side that he lost after having a root canal done that failed over a number of years. We ended up taking the tooth out and letting it heal for a couple of months, and then he came back for an implant placement. Once the implant is placed, then it takes another couple of months to be able to put the tooth on top of that. So I'm going to walk through the process that we did on just placing the implant. You can go to part 2 once the crown is placed on top, and we'll have a video for that as well. I do have a disclaimer that some of the pictures, even though the surgery was relatively minor, there's a little bit of blood and some tissue, so if that makes you a little bit squeamish, you may not want to watch that part. So let's go ahead and get started. So the first thing that we do is we take a 3D scan to understand how much bone is available and how much, both front to back and side to side, how much bone is available. And then we can see, are there any other anatomical landmarks that we might run into that could be a problem. On the top, there aren't that many landmarks to run into, but there is your sinus cavity, and you can see that in this x-ray right here, where the sinus cavity is here, and on the side view right there. On the lower jaw, we do worry about the nerve that's down there as well, so we do planning for that. This 3D scan that we do creates an enormous amount of information that even in just recent years we haven't been able to have, so it's made the process a lot more accurate, a lot easier for the patient, and I think the end result is a lot better. So in this view, what we're seeing is where I've planned to place the implant here on the upper right side, and this is different views. This is a 3D rendering of his jaw, and then you can see more of a 2D view of where that's going to go in 3 different dimensions. A little bit later, I'll show you how we can manipulate that data. So you can see here on his upper right side where he is missing that tooth. That tooth was extracted, and then we allowed it to heal following some grafting that was in that place. So to place the implant, we use oftentimes, not all the time, but oftentimes we'll use a guide, and the guide fits exactly over the teeth where they are now, and then the hole represents where the implant is going to go. So you can see how that is. Now, to place the implant, first you need to make a small hole that the implant can fit into. To do that, we use a series of drills that are getting a little bit larger with each successive drill. And by using this guide, it will allow us to neither go too deep or too far side to side. So what you're looking at is the hole will stop the drill from going too deep, so the implant will go exactly where you want it, and it won't allow it to hit the adjacent teeth either. Following the use of the guide, there is a hole that's remaining. You can see there a little bit of blood on that upper right side near the arrow, and but that spot is ready to have the implant placed. And then this shows the implant that we're going to be using. You can see this is the implant here to here. This is the drill that we'll be using to place that. In this case, the implant goes into the spot and then slowly is placed into the space that's there. Oftentimes people worry that this is a process that might hurt or might be uncomfortable, but in talking to many patients that have had this done, very few experience any discomfort. Of course, he's totally numb during this process, and then following the procedure, there's a little bit of soreness for a day or so, but relatively mild. Here's the picture following the placement of the implant. You can see the implant is right in this spot here. And then we place what's called a healing abutment. Sometimes I call it a little manhole cover that goes on top, and it just protects the implant while the implant is healing. The implant needs about 3 months or so for the bone to start to solidify into the implant, so it's good and solid and ready for the tooth that will go on top. Following the implant placement, we took another x-ray to verify that the placement was where we had wanted it. And I think this is really the cool part and the advantage of using this type of technology. On the top here, you can see where we plan to place the implant. So it's going in between 2 teeth, and there's plenty of bone front to back. Here's the sinus cavity, so we're a couple millimeters away from that. And then here on this x-ray, you can see that the implant went exactly where we had wanted it to go. I'm very pleased with the way that turned out. So I wanted to show a little bit about how we do the planning. This is the 3D software that we use. So this is where I got the screenshot for the previous slide, and this is the implant that we're going to be using. And you can see that I can change where I want to put it. I can make it deeper. I can make it a little bit shallower. I can move it side to side. And what's cool about this is that you can see when I make a change here, it changes in every other dimension, and you can see that up there. So let's say I wanted it a little bit further this way, then you can see here it makes it a little bit closer to the inside of his mouth. Same thing here. This shows a 3D rendering of his jaw, so you're able to see his whole mouth in place. Cool. He also did a video for us explaining how the process went for him. If you want to go to youtube.com/Cary Dental, you'll be able to see his interview that was there. And I think that's pretty much the end of the presentation on 3D printing and guided implant placement. We'll have another one after we get the tooth in place. If you have any questions, give us a call. Thanks.